Our final speaker is a wealth of experience working in international development. Indicative of his knowledge and expertise, he was asked to head up USAID's Haiti response immediately following the Haiti quake on January 12th. And that work remains in his portfolio and his position as Senior Deputy Assistant Administrator for USAID's Bureau for Latin America and the Caribbean. So, it is our great honor to introduce Mr. Paul Weisenfeld. Paul?
Thank you very much. First, I'd like to thank IMA and its President and CEO, Rick Santos, for the honor of addressing you and your guest on this 50th anniversary celebration for IMA World Health. This is really a great honor to be here in front of all of you today. 50 years of bringing life-saving medical services to the world's poor and most vulnerable is really a tremendous accomplishment that needs to be lauded and celebrated, and this is really a very fitting event for that. I'd also like to start off by saying that IMA's work is really in direct alignment with USAID's efforts around the world to promote long-term sustainable solutions for developing countries. IMA focuses, like we do at USAID, not just on satisfying immediate needs, because as I was talking to Rick about before the event, you can find needs all over the world. There are needs everywhere, and the real difficult question that all of us face as we work in development is, are we focusing and concentrating our efforts in a way that not just addresses the immediate need, but provides sustainable solutions? And I know that that's at the heart of IMA's work and the heart of IMA's mission is, how do we help countries, how do we not provide services to countries, but how do we help countries provide services on a sustainable basis for themselves and for their population? So it's really a tremendous partnership that we have here. IMA has been a very valuable partner to USAID for many years, particularly in Haiti. And all my experience has been around Haiti, so I'm obviously going to speak mostly about the Haiti example. As everyone knows, even before the earthquake that devastated Haiti in January, it was a country with deep development challenges. And it was often, other speakers have remarked that it's the poorest country in the Western Hemisphere. I've been at so many of these events, and I've noticed that Haitians often, it's a tag that doesn't ring well with people. People don't want to be referred to as the poorest country in the Western Hemisphere, but it is a statistic that it's our job to change that, and that's kind of part of what we're about. IMA and USAID have worked together to provide Haitians with vaccinations before the earthquake and treatments to common, preventable, and manageable diseases to try to improve the quality of life there on a sustainable basis. For example, one of the big important programs that we manage worldwide is part of the PEPFAR program, which many of you probably have heard of, the President's Emergency Program for AIDS Relief. Through PEPFAR, IMA World Health manages the procurement and distribution of antiretroviral drugs in healthcare facilities in Haiti, so that people suffering from AIDS can get treatment and can really move forward with their lives in a way that wasn't possible beforehand. Currently, we're funding IMA World Health in their leading implementation of, as people who are working in this program know, the Mass Drug Administration Program for lymphatic filariasis in conjunction with Haitian Ministries of Health and Education. And the administration of drugs to entire populations that this program does is really a critical intervention, implementation regardless of disease status. It's a critical intervention to help control, prevent, and eliminate common and widespread diseases. In fact, other speakers have mentioned that IMA representatives excuse me, were just meeting with USAID regarding the partnership in neglected tropical diseases in Haiti exactly when the earthquake hit. And several of them were trapped in the rubble in their hotel. And I know that some of them are here with us tonight, and we're going to hear them tell about their experiences, and there was tremendous loss that IMA World Health suffered, and our heart certainly goes out to all of them for their suffering. It really is a huge tragedy, this earthquake that is still confronting us today. But I'm happy to see that the folks who returned are safe and sound, and it's really a tremendous testament to IMA's dedication, the work that they've continued to do in Haiti and around the world in the face of those kinds of challenges. We need to continue working with the Haitian government to strengthen its capacity. We have to have strong partnerships with the international community of donors, with the NGO community, which is bringing more resources to bear than we are as the U.S. government. So we see our role as one of partnership, as one of leveraging, as one of kind of empowering Haitians to lead lasting change in their lives. Despite the challenges, we're optimistic. I mean, I guess we're in the business of optimism. If you work in development, you're in the business of optimism, right? So we're optimistic. Haiti's going to move forward. It's a special moment where people in Haiti are coming together and thinking this is a chance to remake their lives. And the phrase that you hear over and over is build back better. So we're happy and prepared to be part of that effort to build back better. So that's a lot about Haiti. But I do want to conclude again thanking IMA World Health for this wonderful opportunity and the wonderful dinner. I particularly love the dessert. And congratulations on your 50 years of providing healthcare solutions, and happy birthday and best wishes for the next 50 years.